My name's Jordan Kerker. I'm an orthopedic surgeon and I've been doing CrossFit for about 2 years now. First time I heard of CrossFit was from a patient that came to me after running a Tough Mudder. He had rolled his ankle. He told me he was training for it, doing CrossFit, which was some unique combination of gymnastics and Olympic lifting, and performed at a high intensity. I remember thinking to myself, I'd never heard it before, but this guy's crazy and I'm going to be seeing a lot more of him in my practice. So I stopped working out about 3 years ago. I was taking care of a lot of athletes and weekend warriors that were getting injured and needed surgery. I had a young family at the time, a new career. I just couldn't take the chance of getting hurt. So I was quickly out of shape and gained about 20 pounds from eating garbage. So I decided I needed a change and started to go to a traditional gym, which left me pretty unfulfilled and had a hard time after about an hour of working out of even breaking a sweat. So things changed when my friend told me about CrossFit. The first workout was a 12-minute AMRAP. It was a kettlebell complex where one partner rested where the other one worked. So I essentially worked out for about 12 minutes. And all I remember at the time was lying on the floor, staring at the ceiling, gasping for air, thinking I was going to die. So it took me a week to recover from that workout, but I haven't looked back since. Since then, I've been in better shape than I ever was in my teens and 20s when I was playing sports competitively. It's changed my life, and I believe it's a unique way for people to improve their health and overall mental well-being. CrossFit gets bad press for high risk of injury, and I think it's a result of the mainstream fitness industry that's both intimidated and threatened by its popularity and effectiveness. There's no question that shorter workouts with functional movements performed at high intensity is the most effective way to train. But the truth is, CrossFit's no more dangerous than any other athletic activity, and I actually think it's less dangerous. I'm an orthopedic surgeon. I treat sports-related injuries every day. Few, if any, are ever a result of CrossFit. The bottom line is CrossFit's not dangerous. Uneducated people are dangerous. If you've never done CrossFit before and you come into a CrossFit gym and try and deadlift 400 pounds or do a ring muscle up, there's a good chance you'll get hurt. But that's not what CrossFit is about. It's not what it promotes. Education is a critical part of the CrossFit program. So I was destined to have back problems. My father underwent 2 spinal surgeries in his 20s. I herniated my first disc when I was a medical student. When I was a sports medicine fellow in Los Angeles, I lifted a very heavy patient in the operating room and felt a pop in my lower back. I had progressive leg pain over the next 2 weeks and couldn't stand for more than 2 minutes in the operating room. I eventually had an MRI that showed a large herniated disc that compressed a nerve that was sending shooting pain down my leg. The pain was so intense and I couldn't work that I had to tell the spine surgeon to just take it out, so I wound up undergoing spine surgery. Over the next several years, I developed progressive arthritis in the lower back, and unfortunately, I haven't been able to do a lot of the normal lifting that I thought I could do. But since starting CrossFit, my core has never been stronger, my back's never felt better, and although I do have to modify a lot of the Olympic lifts, CrossFit still remains an essential part of my life. The beauty of CrossFit is that every movement can be scaled or modified in some way. If you have back problems, shoulder problems, or knee problems, you can still do CrossFit. You just have to modify your movements or scale your weight in order to prevent further injury. But CrossFitters tend to be active people. Most of them are not getting injured doing CrossFit. I've treated a number of CrossFit athletes, and all of them have returned back to CrossFit, both with encouragement and proper guidance.
I met Dr. Kerker about 4 years ago. He did a hip surgery of mine when I was 21. He's been my savior through 2 years. He got me back to life twice, got me back to CrossFit twice. Dr. Kerker is a lifesaver. You can walk in, and especially if you're CrossFitting, he doesn't just say like, okay, you can walk, but don't run. It's, you can do a push press, you can do a pull up. He can relate to you on a level that you understand. I never would have recovered the way I recovered, especially from a torn Achilles, if it wasn't for him.
I hurt my shoulders, and I also tore my ACL and my meniscus. That's what led me to see Dr. Kerker. Going to a doctor that knows, it was amazing because when I got my MRI I went like the day before, the next day he got the report, he called me at home, and like, what other doctor does that? He knew that I was going to be doing CrossFit, and he called me and he said, no muscle ups, no nothing. So it's a privilege to have a doctor that understands, who does it.
Whether you're doing CrossFit or some other fitness routine, you need to be smart about your fitness. A good warm-up is critical. Most injuries occur because people aren't properly warmed, their muscles are tight, and they haven't stretched well. You need to know your limitations. Most people are not going to lift as much weight as Rich Froning and Jason Khalipa. You need to pick weights that work for you during your workouts in order for you to have perfect form during those lifts. I have the benefit of having a coach and owner of my gym that stresses this on an everyday basis, sometimes ad nauseum, but it does work. And it's imperative for you to have an owner or a coach of your gym stress this principle that perfect form is essential before you increase weights.
CrossFit does not get you hurt, you get you hurt. If you do 50 perfect deadlifts, right, you're not going to get injured. I try to make sure that their form is correct, doing a weight they can handle. They think if they're not doing a lot of weight, they're not really working out that hard. It's not like that at all. I say give 100% effort, lift as much as you can with perfect form and full range of motion, and it's going to work. When you're doing CrossFit, your power rating is supposed to be high. If you're doing CrossFit exhausted, the benefits are not there. It's not efficient. Go as hard as you can go until you feel like your power is diminished, and then rest, and then do it again, and keep working out like that. That's the way to train, and that's how athletes train, and that's the way to get results. If you keep working out and you're exhausted, you're either going to get hurt and you're not going to see any results, so it's not worth it. It's good that we have an orthopedic surgeon in our gym that's actually doing CrossFit. I go to him all the time, ask him questions, regarding the body and joint mobility and all the stuff that he's able to answer. So it's good to have him to fall back on if I'm not sure about something. And he realized that it got him in great shape.
CrossFit's not about lifting heavy weights for as long as you can until you break. It's a lifestyle. It just happens to be in the context of a fitness routine that translates to everyday life. I used to hate working out with a passion, so I didn't. Now I get depressed when I don't go to the gym. I want people to know that despite an injury, a chronic ailment, or even surgery, you can still exercise, stay in shape, and change the way your body looks and feels. With CrossFit specifically, you never have to worry about what you look like or how much weight you're lifting. There's a reason that you'll never find a mirror in a CrossFit gym. CrossFit's not dangerous, and if you just gave it a chance, I guarantee there's no better way to control your fitness and ultimately your life.
Nice job, guys. Great job.